only ice chip. But even then,
No. Nothing. NPO is nothing by mouth.
Nothing. Like pre-surgery, right?
Or say you come in, say you're critically ill and
I don't
we
know.
have.
What does the actually stand for, please?
That's what I'm saying.
Oh, okay.
Oh, you don't know.
Nothing by mouth.
Just means nothing by mouth, okay?
But it's got to be nothing per.
Orifice?
I don't know. Look it up.
It's fine.
Doesn't matter. Doesn't matter. Means don't feed your patient. Okay. And then, are they receiving nutritional supplements? You know, a lot of times, like our chemotherapy patients are just so nauseous they don't want to eat. You know, things of that nature. So we would want to address that. Okay. So if somebody's NPO, that's a concern. Now, musculoskeletal. This is saying that we want to look for all kinds of things in integumentary, musculoskeletal, integumentary, and then our whole range of motion, which we're going to do after we take a break, is kind of all goes together. You can kind of do that all at once. You could mix it into your assessment. You could do all of that, you know, either together, separately, whatever you had, bits and pieces of time. Okay. So what you're going to do is, for musculoskeletal, you want to inspect bony prominences. Is there any breakdown or lesions? When we give our bath, we would check for that. We also check for scars and moles and all that kind of stuff.
What are you looking for when you're looking for scars?
We have to document them. If it's a new assessment, brand new patient into the hospital, and they come in with breakdown, that has to be clearly documented because there is, if you get a hospital-acquired skin breakdown, your insurance company doesn't pay. So skin assessment is a huge other can of worms. Which
So any old scar?
Yeah.
Well, we just document it, like it just says scar on this, you know, or like if there's evidence of a breakdown, like if we turned him, he had some redness on his sacrum, we want to document that, we want to position him on the side, etc.
Okay. So scars could be, you want to make sure they're old. And
On admission, we just would note it, or we'd say if there's sometimes a big scar on their stomach, and if somebody had their spleen removed, we might want to know that. What's that from?
Yeah,
You know,
right.
that kind of stuff. Okay, you can tell an old scar from a new scar. Yeah.
With like take the moles, like you have a lot of like little freckles and stuff.
No,
What do we do?
no,
Just any like.
No. Anything that's like, have you ever seen like those big moles that look like they need to be removed?
Okay.
Have you ever seen that kind of stuff?
Yeah.
Yeah, those kind of stuff.
Like,
Stay out of
Oh.
hospital.
Yeah, but as long as it's not like bleeding, like there's moles that people come in with that are bleeding and that are issues, like things that have not been taken care of. Those are the things. We're looking at bigger things.
Okay.
Not little tiny freckles and things. No.
I just have a question in regards to all of this. In regards to assessment, are we doing this to every patient?
Yes.
Okay, because anytime I got administered to the hospital, I've never had none of this done.
How do you know they weren't doing it? They didn't
Yeah,
talk to you
not
about
as
it?
extensively, but they were probably.
If you're a
I mean,
healthy,
you have blood
all
pressure
sorts of-
and like stuff like that, but they didn't do any of like the.
nobody listened to your lungs, listened to your stomach, checked your pulses.
I've never had anybody check my skin.
Yeah, see, like skin.
I've never had
or-
anybody look at
Were
my
you
body.
admitted to the hospital?
I had been admitted, and I have been in ER several times.
Yes.
ER is not as worried.
No?
Oh,
ER is
okay.
not
I've
as
been
worried.
in ER.
You get admitted to the hospital
And
they
they
have to do a
care.
skin
They
assessment.
were obsessing on a cut on my leg. Like,
Yeah.
how long have you had that? How long has it been open?
Because now this probably happened about a year ago. They changed reimbursement. So if you come into the hospital and you do not have a skin tear and you get one in the hospital will not pay for any treatment of that skin tear. So the hospital or the insurance company.
Yeah.
So the hospital eats that cost. It's a really big fight now. So there's classes on skin documentation.
Yeah, and Sue
It
was
really
alluding
has
to
changed.
that, and
It's
that's
very,
crazy.
very different.
That's-
Very time consuming for the nurse.
But they did that while you were like the emergency.
No, I was operations, so
Oh.
pre-op,
Okay.
and then one, they don't want you to have any open sore. This was an old scab that I nicked shaving.
Okay.
And so I was like, oh my God, you gotta operate today because it's in my schedule. Do not, just stay me down, do whatever you have to do.
So what do the physicians do? Will they go and check our
And they
entire chart,
checked
make sure
everything
that
out,
they
you know,
agree, like,
pretty well.
what's that?
And that was
For
when I was
what are they
awake.
checking it for what?
I mean, apparently I have an esophageal
Seems like a doctor
that was under
should
dental.
If
All this stuff
we
I don't
felt
know.
that there was something that needed the doctor to look at, we would call the doctor to look at it. But he doesn't have to agree with the fact that I say his butt's red.
So they don't like.
Okay,
supervise
that's your
our-
assessment, your
Not that your butt's
documentation.
red. Just saying that.
My
But like if we turn you and I see redness and like they need to be positioned, that's, or if I say edema, he doesn't come back and say, no, that's 3+, that's not 2+, like he's not on.
Okay.
No.
So we're essentially.
We're it. You're it. You got a big job.
Defense.
Yeah, you got a big job.
That's what I was thinking.
The other thing is turgor and temperature. So we had kind of talked about that when we were gonna do the cardiovascular assessing for that. Turgor means like you pinch the skin and you see, like, does it stay tented or does it kind of go right back? What would it mean if it was, if you pinched it and it went to a point and it stayed there? Dehydration, okay? So poor skin turgor would maybe mean, a lot of it older people, go hang out in a nursing home and do a little skin test.
It does stay there for a while.
I've never actually
A
seen
while.
Like, huh?
I've never seen it before where it stays up.
Yeah,
It
it
stays for
does.
a while.
Yeah, it does stay for long.
Yeah.
So can we do that while we interview our elderly? Do you mind if I?
Also, IV sites,
We're not
this
supposed to
is a
touch
big issue with integumentary. The last thing here says IV sites, and it has to do with, is your IV infiltrated? What's going on with that? Does it look okay? So you would document anything around that IV site, swelling, redness, warmth,
And
we'll talk about that more when we do our IV assessment.
Here in the lab, we're obviously, oh, okay. I was gonna say, we're just pretending.
You're totally just pretending, but you've got to go through these motions, and according to this CPE, you've got to go through that motion of what you're going to go through. The reason I gave you this other sheet is because this has to do more with real life in the hospital.
Yeah.
So if you had to pick 2 areas where you're going to be most proficient, what would they be?
I say the IV at the end there because everyone's got one.
Yeah.
Everybody doesn't have one.
No, everybody. The cardio.
Cardiovascular and respiratory.
Yeah.
So if you're short on time and you're struggling, cardiovascular and respiratory are the way. That's
Yeah,
the
you know,
first.
the breathing.
Yeah, and you can also integrate neuro into all of that.
Yeah.
And your look-see, but I mean, if you don't have time to actually check pulses, turn them, inspect the whole back, those things, don't get tied up on, try to have a priority system in your mind about
So
what
you do
we're
respiratory and cardio and then your
Yep.
pleural?
either one, yes, you could, but I'm just saying, just use this when you're practicing this afternoon, use both of them, but for your CPE, you need to know the other one. Also down here at the bottom, if you turn this page over that I gave you, it says intravenous. It says what size, when inserted. You haven't learned any of that yet, so don't get crazy about that. Okay, and then MD orders. This is another thing. Again, this is my worksheet for the students at the hospital, so they're always looking, has anybody ordered anything else? So that is not applicable for you right now. Okay? So let's flip it back over. Let's go back to cardiovascular and respiratory. So cardiovascular, when you're at Saratoga Hospital, it says regular apical radial pulse, peripheral pulse is palpable. So that means if you had to Doppler pulses, you cannot say yes to this.
Okay.
No edema. Any edema, No calf tenderness. Oh, you know what? We didn't do Holman sign. Here, put that down. Is Holman sign on there somewhere?
It's on
Yeah.
this one.
Okay. So what happens is when I have him push against my hands, okay, he pushes his feet against my hands. If he has pain in his calf, that's a positive Holman sign.
A what sign?
Okay, so let's go back.
It's on the bottom.
That's in the
of
cardiovascular.
under cardio.
Above
It says
capillary
no
response.
calf
Oh.
tenderness is a
Calf
negative
tenderness, okay.
Holman sign. So I just told you the opposite.
Okay.
Which is fine. So if you push against my hands and he has pain in his lower calves,
Then he.
that's a positive Holman sign. So what does that mean? Anybody know what that means? Yeah, a clot. It could be a potential
Oh,
blood
okay.
clot. Okay, so now for the purposes, this is still in your CPE at Saratoga Hospital. Nurses are no longer doing Holman sign unless it's ordered.
Oh, you mean you physically aren't gonna test for that? Like,
No, I'm gonna have them push against my hands to monitor strength,
okay.
but I don't say if you have pain, I don't ask them if they have pain in their calf.
What is that called?
Because what if you say yes? What if he says yes?
You gotta go above and beyond that.
Everybody's gotta get the $1 million workup. and most people had a cramp in their leg.
Oh, okay.
It's not truly indicative. So with certain people, we are checking home and sign if it's ordered, but at Saratoga Hospital, do not be checking home and sign unless somebody tells you to check home and
So
sign.
what happens if they did have something wrong with them though? I mean,
But you don't go there.
okay.
Don't go there because we have this whole DVT prophylaxis now. Everybody gets the knee-high TEDs, everybody gets sequential stockings, everybody gets blah, blah, blah. They get Lovenox in their belly. There's a whole plan to treat it.
Yeah.
So it's not like we're ignoring DVT. This is not a definitive test,
Okay.
and they felt there were too many false positives.
Okay.
So any of us on a bad day,
Is there pain?
any of us on a bad day could push against it, have a cramp in your leg.
Yeah.
Does that
So
mean we all have a blood
But
clot?
there is a difference. It does feel different. I've had the DVT.
Don't go there.
Yeah.
Don't
Okay.
go there. Because I'm just saying the
Yeah.
nurses are gonna get irritated if you're checking it and it's not
Yeah,
ordered because
yeah.
that's a change in protocol. Glens Falls Hospital's different. Very important that you know what you're doing.
Okay.
Yes.
A long time ago, I learned that home and sign was also like lifting up the leg kind of and pushing it and bending the knee. Is that also or no?
Not as much, maybe a more extensive version, but that's not what we do. We're looking at calf tenderness, so no, we don't normally pick up the leg. Okay.
What is
So-
DVT?
Vein thrombosis.
Oh, DV, okay.
Okay, so, absence of chest pain, palpitations, heart murmur, or hypertension. This usually gets people very confused. This is back on here, cardiovascular on here. Okay, absence of chest pain, palpitations, heart murmur, and hypertension. That means right now. That doesn't mean a history of hypertension. So a lot of people want to say yes if somebody has a history of hypertension and is taking a blood pressure medication. And the answer to that is no, not right now.
Not right this second.
If they're hypertensive, I take your blood pressure, it's 200 over 100, I would have to say yes to this.
Yes.
Even if they don't have a history of it, because right now they're hypertensive. Does that make sense?
Yep.
Okay, so let's just look at the respiratory. Respiratory is pretty straightforward. It says respiration's non-labored. Remember how I said labored means that they look like they're having difficulty breathing. Bilateral breath sounds clear and audible on auscultation. It's very clear. So if you're not clear, say there's slight wheezing, then yes, you have to say no to this. You don't agree and chart that there's a wheeze. Does that make sense? This is a lot, you guys. So I don't want you to be overwhelmed because we're going to practice and we're going to do this, okay? We still have range of motion to do as well. But what I'd like you to do, yep. But let's do this first. Let's take a break, okay? Everybody get a snack. Come back. And then we need to go through an assessment on each other. I want each person to do it. So you need to do it on somebody, somebody needs to do it on you. And then we can revisit the vital signs. And then we'll give ourselves like an hour to do that when we get back. And then maybe we could do range of motion and then we can just continue to practice.
How long for a break?
I would say 20, 25 minutes or 30
Okay.
minutes, like try to come back so that we can get
Coffee? Coffee run?
I had coffee this morning, and I swear, is it me, but does coffee make you pee a lot?
Yeah.
Oh, okay.
You don't want to go?
Yeah, I'm good.
Oh, sure.
This morning.
Yeah, sure. Yeah. No problem. Thanks for being our patient.
Oh, I know.
Good job, good job. Jamie, is this your book?
Yes.
Okay, so I'm going to leave her book out here. If you have your book, you might want to refer to this when we're doing the assessment pieces.
So my 12-year-old is definitely puberty. He's larger than me. I can use this one. Okay. I won't use it on my other two younger. But he's perfect. Yes. Yeah.
I'm going to go back off.
Didn't you have a gift this morning, girl?
Yeah, and
I've got 2 more of these in my car. That's what I wish I had them hot, but I do what I gotta do.
No, okay. Thank you. I have another one.
It looks good.
What was that? Yeah.
I have
Why did you have a cereal?
granola bars.
I know.
These are good. You want one?
It's okay. I just had my.
You're
banana.
good.
Yeah,
Okay.
I'm good. Thank you.
Yeah.
You know, I really know what it means. Now, so I usually have one meal a day, and I don't have much time for my